Hi, and welcome to the webinar for the Accelerating Nursing Transforming Healthcare Research Report. My name is Linda Benton, and I represent Johnson & Johnson and our 125-year commitment to supporting the nursing profession. And of course, today I'm surrounded by some very amazing nurses who also have contributed to this work, and I'd like them to introduce themselves as well. Robin, you'd like to start?
Hi, Linda. My name is Robin Begley. I'm the CEO of the American Organization for Nursing Leadership.
And hi, I'm Debbie Hatmaker. I'm the Chief Nursing Officer for the American Nurses Association Enterprise.
And my name is Oriana Boret, the VP of Innovation at the American Nurses Association.
And I'm Mary Beth Kingston, the System Chief Nursing Officer at Advocate Aurora Health.
Thanks, everyone. So we're super excited to share this research with you today, breaking down the learnings from our qualitative research as well as our quantitative research, supported by exemplars and the real-world case studies that we have gathered through the course of this research. Our goal here today is to make these learnings come to life in a way that's clear and actionable for all of you tuning in today. So first things first, I'm going to turn things over to Mary Beth.
Thanks, Linda. Just would like to say that this study is the result of a partnership. And I think that is one thing we have seen during the entire COVID-19 experience, different organizations and groups and people working together. So it's a partnership with Johnson & Johnson, the American Nurses Association, and the American Organization for Nursing Leadership, with the goal of achieving a number of objectives. First of all, to try to understand the profound impact that the pandemic has had on nurses and the nursing profession itself, from nurses and also from other stakeholders. And we do know that we are still in the midst of this learning and this pandemic. Secondly, to capture the innovation and advances that nurses have led. And we often see this as an outgrowth of crisis. And then lastly, to chart a path forward. You know, from a health system CNO perspective, we know that we are not going to return to the way things were. And in fact, there are lessons and practices that can accelerate and elevate the role of nursing in transforming healthcare locally, regionally, nationally, and yes, even globally. This research provides practical recommendations, as Linda mentioned, and exemplars, which capture the challenges and also the innovations in the face of adversity. And this will be extremely helpful for nurse leaders as we continue to forge a path through and beyond the pandemic. It also aligns with and reinforces findings from other key reports, including those from the Tri-Council for Nursing, the American Association of Colleges of Nursing's Essentials for Nursing Education, and the National Academy of Medicine's Future of Nursing 2020-2030 report that all call for the need to transform our current systems of care and care delivery through the tremendous potential and power of the nursing workforce. And now I'll pass it over to Linda to walk us through our methodology.
Great. Thank you, Mary Beth. So how did we get this started? We started with a very large quantitative market research study in the summer of 2020, where we actually had over 4,000 participants, including nurses, nursing students, advanced nurse practitioners, as well as healthcare administrators, physicians, and consumers. And our goal of the research in the quantitative phase was really to understand, to Mary Beth's point, the impact of COVID-19 on the nursing profession, you know, while the pandemic was basically in the early stages. And what we found was interesting, was that certainly, as we expected, the pandemic has had a significant effect on the nursing profession at that point in time. At the same time, we did find that with the pandemic and all the urgency that went along with that longstanding barriers were reduced and progress accelerated at exponential rates. That was really important for solving some of the many healthcare challenges that we faced during the pandemic in the early days. And we also learned that nurses were very much at the center of that work. So once we wrapped up the quantitative research and we took a look at everything that we had there, that then informed where we went to phase 2, which was our qualitative research. So before doing that, when we looked at the quantitative, we broke it down into three separate working areas. One was care delivery, the section was organizational structure, and the third was workforce of the future. There was so much to learn from the quantitative research. We had to break it down into these three buckets to make it more clear and actionable as we did our listening tour around the country, you know, the following 6 months. So from that point on, we then interviewed over 33 nurse leaders and nurse advocates who were experts in this in the various spaces in terms of what took place during the pandemic. And from there, we were able to gather these collective learnings, break them down into 3 distinct papers, and publish them on the nursing.jnj.com website. There, you are going to find the key findings from the papers, the core enablers that took place, as well as what is really needed to advance this work as we continue to move through the pandemic and hopefully get on the other side of it very soon. We cannot afford to allow the nursing profession and healthcare as we know it to go back to the way that it was. It's time to continue to move things forward, and we think that this report is going to play a very instrumental part in that role. So I'm going to turn it over to Robin to talk a little bit more, first and foremost, about some of our quantitative findings.
Thank you, Linda. So on the screen, you can see some key findings outlined from, as Linda said, our quantitative research. These results are derived from the responses of the nurses that were surveyed. We all know that nurses are critical to healthcare delivery. However, nurses expressed that they were undervalued and underappreciated. As nurses look to the future, they expect that their roles will be even more important as the healthcare system evolves. Yet they're dissatisfied with opportunities to lead and influence in workplace decision-making, recognition, advancement, and innovation. On the plus side, we also see that the onset of COVID has generally intensified the sentiments of the respondents about the importance of nursing. Now, I'd like to hand off to Ori, who will also share some additional quantitative findings.
Thanks so much, Robin. The qualitative research had 6 primary findings. The first being that stakeholders believe that nursing leadership and their roles in interprofessional teams are crucial. The second, that nursing education has to build upon the healthcare acceleration stemming from the pandemic around areas of continued leadership development and innovation. The role of advanced practice nurses are without question, and increasing the support to expand these roles are critical to healthcare. Nursing innovation must extend to the inclusion and development of health tech and data-driven healthcare, as we see daily the importance of mental health and wellness of individuals across our profession, and how we care for the underserved and address healthcare disparities. Passing it off to Debbie.
Thank you, Ori. The qualitative research findings are organized into a variation of the socio-ecological model, which includes 4 conceptual levels. And while some of the findings fit very neatly into one level, there's often interplay so that a recommendation may actually require change across multiple levels. So I'm going to hand it back off to Linda, who's going to share more about the key findings at the individual level as we walk through these 4 levels. Linda?
Great, thanks, Debbie. And I think what we want to look at first is that chart there on the right of the slide that speaks to what we learn, particularly from the nursing students when you're looking at the educational system. And I believe this was already referenced just a moment ago, but I think it bears worth repeating that what we heard from nursing students in the research is that they're very interested in getting more time spent in the area of development in terms of interprofessional collaboration, innovation, as well as developing leadership skills. So that's what we learned from nursing students. But when you break it down overall, across the overall report in terms of what we learned at the individual level, one of the first things was, and this shouldn't be any surprise to any of us, is that it's critically important that we are prioritizing nursing mental health and well-being. Certainly, what we've been dealing with through the pandemic in the last 2 years is something like we've never seen before. But I think it's also fair to say that things were not great even prior to the pandemic when it comes to how nurses were feeling in terms of mental wellness and resilience. So I think one of the key things that we have found in this report is that things have continued to escalate. We need to make sure that we're getting under the hood and really understanding what is driving the challenges that our nursing workforce and others on the front line are currently facing today, and then take steps to address it. We've got to prioritize the mental health of our front line. The second thing that we learned at the individual level relates to basically being more flexible and providing additional educational pathways for the nursing workforce, as well as cross-training opportunities. So I think, it goes without saying, when you look at anyone inside the nursing profession or outside the nursing profession, people generally benefit when you can expose them to different developmental opportunities to continue to build their skill sets and diversify their skill sets. The nursing workforce is no different. And I think we saw some golden opportunities come through the pandemic in that way, that nurses were able to really grow and flex and develop in new ways that we hadn't seen in an ordinary circumstances before. I think another key area here is that we want to really think about how we're exposing the nursing workforce to different patient care areas and give them different experiences. Whether it's a student coming out of nursing school who's getting ready to graduate and go into practice, or whether it's nurses actually working within the system itself. I think there's a lot to be said for continuing to expose our nursing care professionals who have so many diverse and important skill sets, but expose them to patient care in areas inside of the acute care situation, but also outside as well. In the communities, at home care, you could talk about school-based care, the homeless population. There are so many different people living in so many different communities across the U.S. And I think it's very important as we think about where our healthcare system is going, that our nursing workforce is really well prepared to provide care wherever it is needed. The next thing we looked at is really the importance of implementing more flexible career options for the nursing workforce. I think that, the days that when nurses graduate from nursing school and go into one role and they stay in that role for the next, 30 to 35 years is probably on the downside. I think people today, and what we found from our research, is that nurses are looking for greater flexibility in their career path. And they're looking to flex their skill sets and build their skill sets and get differential experiences where they can bring more benefit. Whether that's telehealth, IT, finance, HR. If you think about all these different areas, if we could get nurses greater experience in those specific areas, it's a win-win. Because those specific areas that are outside of the traditional nursing line, shall we say, benefit from getting nursing expertise. And also the nurses are broadening their exposure in terms of how healthcare works out of the traditional way that nurses may be educated through nursing school. So we think there's a huge amount to be won by exposing nurses more broadly to the business of healthcare and all that goes on. The last area that I think came out of individual, but I think is also a very important one, is it's really important to continue to leverage the skill sets of nurses and their ability to act as change agents. And how does that happen? Again, I think there's an incredible opportunity for nurses to be able to step in, step up, and lead, and use your voices. Be visible. Get involved in those different teams that might be out of your typical workday as a nurse, but continue to build your skill sets and build the influence that you bring to bear. So whether that's starting to getting on a board in your community outside of the nursing workforce altogether, but just using your voice and flexing those skill sets. Or it's looking at your place of work and understanding where you can add value and add your voice to conversations important to your place of work. So I think it's a huge opportunity for nurses to continue to be visible by utilizing your voices to really share what you know and what you can bring to bear. So what I want to do now is to turn the page a little bit and talk about some case studies that I think are really interesting that kind of speak to the points that I've just raised with you this afternoon. So the first one is one that I really am so excited about, and that's with Humana. So Humana has what I would call, they've developed a scenario that I would call as a definite win-win. It's a situation where they have recognized that nurses that are working for Humana, they have a great need to continue to broaden the understanding of the nursing workforce beyond what they might typically be involved with. So broadening their knowledge of the business of healthcare and how healthcare works. So what Humana has been doing is taking intentional steps to broadly expose the nurses within their system to areas outside of their usual areas of expertise. And they do this by a formalized rotational program where these nurses are brought into multidisciplinary teams. And it could be digital health, it could be analytics, it could be HR. But basically, while the nurses are in those positions, they are leading or co-leading a specific piece of work in that role. So they're getting exposure and they're also getting development and a deeper understanding of the work that happens there. And of course, the great outcomes that comes out of a system like this with what Humana is using is that it really provides nurses an ability to deepen their skill sets, broaden their exposures. And again, not only does that benefit the nurse, it also benefits the organizations or the part of the organizations that they've been working with. And then ultimately, I strongly believe that that's going to benefit patient care. So great example coming out of Humana and with our Chief Nursing Officer, Kathy Driscoll. Another example I wanted to share was with another amazing CNO by the name of Ina Williams. And Ina is the CNO at Yale New Haven, and we had some great learnings coming from Ina when we spoke with her as part of this research in terms of the steps that Yale New Haven took to ensure that the nursing voice remained in the conversation. So Yale New Haven, as a teaching hospital, has always prioritized nurses having a voice in the conversation and in using their voices as practice is shaped. And then, of course, the pandemic hit. And when the pandemic hit, chaos ensued. Not only, I'm sure, at Yale New Haven, but other institutions across the country as well. And so I think in many cases, many usual procedures that were in place kind of went out the window. Well, under Ina's leadership, they recognized that this was a challenge that they wanted to take action on, because what was happening was, as conversations were moving so quickly at this institution and things were changing so rapidly, unfortunately, because of the new structure, they did not have a nurse at the seat with a seat at the table having a part of that conversation. So she made a deliberate move to take the chair of the Nursing Governance Committee, or Coordinating Council, and actually free up that individual's time to act 100% of the time as a liaison between the organizational structure as well as the nursing workforce within the institution itself. So what happened was, she would relay back from the committee what was happening, the nurses would give feedback, they would shape things, and she would take it back. And what happened was, they could make rapid, quick adjustments as needed as the pandemic went on, based upon what the health system was seeing, what the needs were. And what came out of that was not only a number of nurse-led innovations that they were able to quickly institute at the hospital and have continued to do so, but they also brought about an entirely new staffing model that's now comprised of a group of multidisciplinary clinicians made up of staff leaders, staff, educators, and managers, who are all about really looking at this, or taking this model to help optimize matching nurses with the needs of patients and other clinicians, defining pathways to educate and upskill rapidly, so if something like this happens again, they're ready to go, but also really define a clear approach to implementation that enables them to deliver a rapid response. So I think a great example coming out of this institution in terms of really leveraging the leadership of nurses, tapped into the insights of nurses at the bedside, that really delivered improved outcomes for this organization. So now I'm going to turn things over to Robin, who's going to talk about key findings at the system level.
Thanks again, Linda. I think you did a great job of explaining and providing examples of how individuals are really making a difference. I think our challenge next, though, is to really look at how we can systematize some of this activity. So the next few slides describe key findings that have implications from a health system perspective, and then I'll share 2 case studies that illustrate how these findings can be catalysts for action. So the key findings. Protecting and sustaining the nursing workforce by increasing diversity in the profession and providing clear, varied, and rich career path options for movement, development, and leadership. This is really important. We talked how the expectation is not that a nurse will graduate and go work in a clinical area for the next 35, 40 years of his or her professional life. We need to figure out a way to really make movement and, perhaps use the term career lattice instead of a career ladder, but provide opportunities. We need to bolster the focus on interdisciplinary teams and collaborations within and across our health systems. We've seen this time and time again. I believe during the pandemic, it was something that needed to happen and did happen. We can't fall back. We need to continue with our team-based approach. Academia and practice partnerships are especially key to prepare next generation of our nursing workforce. We know that the skills and the competencies are changing. We also need to sustain the innovation mindset of the pandemic period. I think I touched on that a little bit earlier. We have to embrace acceptable risk, give nurses a clear path to innovate, test, learn, and iterate again if that doesn't work based on outcomes. And to sustain this nursing leadership moving forward in both traditional and non-traditional ways. When I think back to what we saw during, and we are still seeing, during the pandemic, we know that nurses are stepping up in ways and in roles. And how can we systematize this? We've seen the value and we know that nurses have the skill set. How do we capture this and make this part of our culture? So our first case study is from the Veterans Health Administration. The issue identified was that the perspective of nurses needed greater representation within the agency structure in order to better inform decision-making. During the pandemic, the role of the chief nursing officer was elevated to the same level as the chief medical officer for the first time in history. This was a very significant change, and it ignited a cultural shift and changed the paradigm, positioning nurse leaders as collaborators with their physician colleagues. The CNO, who, Beth Taylor is our VHA CNO, and she is a remarkable leader, but she also took on leadership oversight and accountability for more than her previous area of responsibility. She now has multiple program offices and leads more than 113,000 VHA nursing staff. She's a great example of how she has taken this concept and systematized some of the changes for nursing leadership. The second case study addresses an issue that many healthcare organizations are currently facing, a nursing shortage that is placing immense strain on health systems, and I think that is not an overstatement by any means. This case study demonstrates how New Orleans East Hospital, a member of LCMC Health, proactively partnered with a local program to provide free nursing assistant training for high school graduates and others who were underemployed individuals. By revisiting training regulations, this hospital was able to implement a team-based model. The benefit of this collaboration between NOEH and the local educational program is that the pipeline was activated and the graduates were able to move right into healthcare roles. Indeed, they had these roles waiting for them. NOEH was able to improve outcomes related to responsiveness and medication timing because of adequate staffing to support the needs of their patients. Another great example. Now, over to you, Ori.
Yeah, thanks, Robin. To build on those societal findings and observations and case studies, when we're looking at some of those other societal level impacts, we, began to understand that bringing care to patients and expanding the ability for care providers to advance this was crucial. We did this through person-centric care that supports diverse needs and addresses inequities. It was expanding new care models, advancing nursing and advanced practice roles, and exploring new ways to deliver that care. We also advance care delivery by embracing current and emerging technologies, which is allowing us, and what we've seen is to modernize healthcare at scale. We're seeing this already with virtual health, remote monitoring, health apps, and patient portals. Technology is creating new entry points to care while breaking down those barriers, which can include factors like location and language. And this is starting today, right? It starts in your own organizations, within the roles that you lead and the areas that you work, by celebrating nurses' voices and recognizing their vital role in healthcare. The public has always trusted and regarded nurses highly. The pandemic has put a spotlight on nurses' skills, leadership, and critical presence across healthcare. Organizations must embrace, value, champion, and advocate for nursing's expertise, and elevating the work and voice of nurses ensures their novel approaches, models, and insights are visible across the continuum of care. And supporting and facilitating nurse ingenuity is key, right? This is building on that innovation. Nurses have demonstrated their capacity for designing solutions that are easily adopted for people in clinical use, not to mention user-friendly, which we know is paramount to things being adopted. Nurses' unique vantage point has led to the development of entirely new models of care delivery, and current structures and work processes can limit time or channels for nurses to develop their skills. We will see sustainable transformation by investing in nurses and promoting their capabilities and skill sets across healthcare. So when we look at the next case study, it's a great example of how a virtual hospital significantly expanded access to care for patients. Atrium Health, which is a health system headquartered in Charlotte, ramped up an existing virtual hospital model, which needed very real staff and resources to run it. The virtual care setting was led by the health system's chief nursing executive, who ensured all of the necessary regulatory considerations and managed the CMS waivers implemented during the pandemic to ensure reimbursement for these virtual visits. Software allowed staff who had been trained to deliver virtual care to be matched with patients in various areas and with unique care needs. The best quote was from Maureen Swick, the Senior VP and System Nursing Executive, who stated, "No one ever thought it would be ramped up so quickly and so dramatically." And at the time of our interview with her, she stated that over 40,000 patients had been cared for through their virtual hospital program. Waivers for virtual care were temporary with the pandemic, and unequivocally, she felt that providing care for people in their homes was the right thing to do. And then our second case study actually comes out of Boston and is looking at unpacking the formal system that was built to translate nurse innovation into practice. And what was launched between those two Boston area hospitals was a COVID-19 Innovation Center. Together, they developed programs dedicated to COVID testing and treatment, the design and development of personal protective equipment, and data analytic programs to track it. The nursing director and innovation champion, Chaim Nadal, said the center worked because everyone was invited to the table, including community members, with a common goal, and with that, funding barriers dissolved. It also worked well because nurses were deeply involved in both development and testing. She said almost everything that came out of the center had to be tested with nurses because people recognized that nurses had to be included because they knew every process and piece of equipment that touches a patient. This elevation of nurses was critical to the success of their innovation center. Passing it off to Debbie.
And now we're at the fourth level, that of policy. And many nursing and healthcare associations and organizations were heavily involved in policy throughout the pandemic. And work has to be done at the policy level to really maintain the changes implemented during the pandemic and allow nurses to deliver the level of patient care for which they've been educated. The findings in this area include that of education. Education was mentioned earlier in the individual level, but here we're talking about addressing faculty shortages and limitations in nurse education. To support student entry in the field, we believe that public health funding, and the data show that public health funding should be allocated to make nursing jobs more appealing in those considering the profession, but who might be concerned about finances. Once in school, education opportunities must also be enhanced beyond acute care, because that's where care is going. Secondly, to build a national workforce plan for the future of healthcare. Workforce must be prepared for all the coming changes in healthcare, where the delineation between illness and wellness and social care will become much more fluid. Healthcare is no longer going to take place in just the hospital or the ambulatory offices. Many tools are coming about with the Internet of Things, smart house designs, telehealth, and many other novel care approaches, and we believe that's going to sustain people in their communities and in their homes. In order to accommodate this, changes in the nursing workforce should be planned on and planned at the national level. And then the third finding was to secure and enhance scope of practice. To support the changing needs of the population and to develop the workforce to support it, nurses must be able to continue to practice with full capabilities and practice authority that actually occurred during the pandemic. The changes in scope of practice laws and regulations, including that of prescriptive authority, were very critical to support the influx of patients during the pandemic and must be established permanently. So now moving on to our first case study in the area of policy, we're tapping into novel partnerships to deliver care in new ways. The CARES Act helped organizations collaborate with others to transform care in a number of populations, including the homeless population. Nurses were able to orchestrate services, including shelter and treatment. And we heard from Lauren Harden, the senior advisor of Camden Coalition's National Center for Complex Health and Social Needs in California. There, she told us about funding that was used from the CARES Act toward hotels where the homeless community members could be housed. Ms. Harden pointed out that nurses were deeply involved in the wraparound services connecting people to benefits and treatment for behavioral health and substance use disorder, and holistically starting to solve the homeless problem in a way that communities could not have previously achieved. Ms. Harden said several states required that there was cross-sector collaboration, public health, healthcare, social services, and that brought people together around a table with dollars to fuel transformation. In the second case study in the area of policy, it's that of using evidence-based models to design staffing and patient care. Within workforce planning, a very important element that was discussed was the need to embrace the most effective staffing models. And we heard from Chief Nurse Executive for Emory Healthcare, Sharon Pappas, who told us about research she and her colleagues had carried out on the value of staffing according to patient risk. The study, which is published in Nursing Economics, they actually measured the patient's risk for an adverse event and then staffed based on that risk, essentially applying nursing resources in order to mitigate the risk. The model was associated with several promising outcomes for the patient, including reduced risk for a number of adverse events. It was an effective model for nurse staffing, which was much more than a head count, and organizations can leverage the knowledge of nurses to achieve both positive clinical and financial outcomes. As Sharon said, it worked. In the end, she said it comes down to both how nurses are utilized and their sense of agency. It's the context of the work environment and the support of nurses' roles in decision making. It's the nurses' professionalism and autonomy. And once you get that secured, then there will be great work done. So I'm handing off to Ori again to talk about promising practices.
Thanks, Debbie. One of my favorite aspects of this work lies in the promising practices section because it highlights the real world examples of how our profession led and worked differently to address the pandemic. We did this by maximizing home and ambulatory care, the informal and formal partnerships that span education and interprofessional teams, the expansion of nurse-led innovations across health facilities, COVID-19 leadership in emergency and organizational response, the rapid deployment of solutions to expand the workforce and support nursing education through advanced technologies, and to address disparities and inequities across our own profession. Finally, to Robin.
Thank you, Ori. So much information. Over the next two slides, I'd like to give just the highlights of the conclusions of our Accelerating Nursing Transforming Healthcare research. These conclusions are priorities for nursing and for all stakeholders as we look to the future. So by focusing on patient outcomes rather than on merely volume metrics, we can put wellness at the forefront, and this can result in new models of care, which then we can critically evaluate the results and iterate and improve as necessary. Through the use of modern health technologies to reshape care delivery and reduce disparities, we can deliver appropriate care to all of our patients. And we can enable this by expanding scope and top of licensed nursing practice. Another conclusion is that we need to empower nurses to lead, and we need to foster partnerships with other stakeholders, like community providers and social service workers. This elevates patient care. By designing new systems and approaches, we can embrace informatics and the evidence base and invest in new models. Novel approaches should streamline administrative burden on the nursing profession and really on all professions in healthcare. This still is a really heavy burden as expressed by our healthcare colleagues. Cultivating the pipeline of nurses to range from entry-level to highly skilled and experienced nurses from diverse backgrounds that reflect the patient population is another key priority. But at the same time, we must work to retain the nursing workforce. We have to work as hard on retention as we do on bringing new folks in through the pipeline. How can we do this? Through building supportive cultures and more flexible, meaningful career pathways. Supportive cultures require that we prioritize nurse well-being and mental health. This is critical. We need to address individual healthcare needs and behavioral healthcare needs, as well as address structural issues. We need to do both. Expanding the spectrum of care can be supported by enhanced partnerships between academia and practice to ensure the next generation of nurses is well equipped to meet the evolving healthcare needs. And finally, building a workforce for tomorrow's needs will involve planning at the national level, including interdisciplinary plans that place nurses working alongside our physician colleagues, public health experts, social service providers, and payers. Now back to you, Linda, for the final word.
Great. Thanks, Robin. And again, thanks to all of you for joining us today for this webinar to explore the research of the Accelerating Nursing Transforming Healthcare report. So we fully realize that this was a lot of information that we just took you through. So that's why we encourage you to go to the nursing.jnj.com website to explore the content of all 3 papers, see what applies to you, and take action and get that conversation going. And then, of course, we would love to hear from you to see how it's going over time and the action steps that you are taking. Thanks again for your time today, and have a great rest of the day.